Good afternoon, everyone. My name is Amos Mwaura. I major in biology in the College of Arts and Sciences. I'm really excited to share my Keystone project with y'all, mapping diabetes in Boston. Before I begin, I want to thank my advisor, Dr. Seuss Weicker. He's actually the chief of nephrology at Boston Medical Center. He's a very busy guy, but without his comments, encouragement, and guidance, this project would not be possible. So to begin, diabetes is the seventh leading cause of death in America. And the best way to explain diabetes is through the analogy of a key. All of us just ate a yummy barbecue lunch, and right now that lunch is being broken down into sugars in your body. That sugar stays in the bloodstream, but to get to your cells, it needs a key, that key being insulin. Now, the problem with diabetes is that the key often is disturbed with diabetes. With type 1 diabetes, basically destroying the key with your immune system, and type 2 diabetes, either producing a key that doesn't work or not producing enough of that key being insulin. And this causes several problems in the body. Right here we see a multi-system failures that can occur from diabetes, primarily occurring with the kidney and the cardiovascular system. But another big problem with diabetes as well is how resource dependent the disease is. For starters, with diabetes, you often need insulin and other medications to manage it. But also, there's other ways to manage it other than medications, such as dialysis, which can be very time-dependent and resource-dependent. And also, diet and exercise especially can be important for managing type 2 diabetes. From here on out, we're going to focus only on type 2 diabetes, by the way, due to the outcomes measured in this experiment, focusing on type 2 diabetes. However, I'll mention type 1 a little bit towards the end of the presentation. So currently in the literature, there's a lot of macro analysis of diabetes, which basically means large-scale analysis of where diabetes occurs. For example, in the United States, Native Americans have the highest prevalence of diabetes, or in the city of Boston, African Americans have the highest prevalence of diabetes. What's missing in the literature is more micro-based analysis, meaning looking at smaller areas of space where diabetes occurs. Currently in the literature, I only found one paper, this Piccolo paper right here, that focuses on diabetes in Boston's neighborhoods. So to expand the literature, I decided to look at Boston's 17 neighborhoods, located over here on the left, and look at diabetes prevalence present in these neighborhoods. These are the factors I analyzed alongside diabetes prevalence, some of them being demographic, such as median household income and diversity index. And to define diversity index, that's the amount of African American, Asian, or Hispanic individuals in a neighborhood out of the total population, so basically non-white. Also, I analyzed some factors specifically related to type 2 diabetes, such as the amount of grocery stores available. As with diabetes, you need to eat certain foods, basically. So this is about the amount of grocery stores available in each neighborhood. Also, physical activity recommended by the CDC, which is about 150 minutes a week, and how many adults were meeting that requirement every single week. And finally, we looked at park area, as in order to meet that physical activity exercise requirement, you need spaces to exercise, which parks being a major one. So basically, these factors were all looked at alongside Boston's neighborhoods. Data analysis was all taken from Boston, City of Boston data, along with census data. I wanted to make sure it was non-biased in me choosing the data, so I wanted to make sure it's all from one central location. And these are the statistical programs I use to analyze my data. I want to focus mostly on the last one, being Arcgis Pro, as this program allows you to make heat maps of different factors in a certain area, which I did, and you'll see moving forward. So, first right here, we have the median household income for Boston's neighborhoods. I want to focus, before I explain this map, on a couple of things. First of all, the more darker areas you see, like the purple and the reds, that means higher levels. And second of all, the more lighter levels you see, like the yellow and Dorchester, that means lighter levels of the measure. And also the fact that for some neighborhoods, I had to condense them together. For example, in the neighborhood of Back Bay, and for Central Boston, for example, that includes areas like Back Bay and the North End. Let me check one quick thing. Okay, the slide is missing. That's okay though. So for median household income, we see the lowest levels are present in Dorchester, Mattapan, and Mission Hill and Roxbury, while the highest median household incomes are present in Central Boston, as well as Charlestown and East Boston. South Boston. Also, grocery store count was analyzed as well. The grocery store count is very high in the areas of Dorchester and Allston, Brighton. And Dorchester is very interesting. I feel this area would have lower grocery store count, but we'll analyze this factor later on as well to explain that. For park area, we looked at how Dorchester has a lower median level, while Mattapan, Hyde Park, and Mission Hill, Roxbury have a lower level overall, and higher levels in South Boston and West Roxbury. Physical activity, the lowest levels presence were mostly in Dorchester, Mattapan, as well as the Fenway and Longwood area. And finally, for diversity index, the highest or most diverse areas are present in Dorchester, Mission Hill, Roxbury, and Mattapan. I decided to end on this map especially because this is the one that shows statistical significance overall with our graph over here with a p-value of 0.015. And that's really important, basically. That's showing that basically means that areas that have more diversity in terms of the residents are having higher levels of diabetes prevalence overall. So then we have to ask, why might that be? Why do these areas that have more diverse residents have higher levels of diabetes prevalence? Well, first of all, going back to the Piccolo paper I mentioned earlier in the presentation, this actually supports the findings from that paper as well. As in that paper, racial and ethnic minorities were also found to have more diabetes prevalence relative to other patients, being white patients. And there's multiple reasons why that might be. So past studies have shown that Boston's one of the more segregated cities in the United States, which you might have seen just by walking around. And basically what that means is when you have a more segregated city, two things can be a factor in terms of health. You can have more disparities in terms of healthcare utilization. So for example, these residents aren't using healthcare resources present in their neighborhoods, therefore putting them more at risk for diabetes. Or there can be limited resources of the local medical institutions. So for Boston, for example, in areas like Dorchester and Mattapan, their main hospital is Boston Medical Center. And papers have shown in the past that these safety net hospitals often have less resources to help manage the residents' needs for diabetes. Now, we need to look at Boston Medical Center as a standalone to determine this. I can't just say that as a whole, but past studies of safety net hospitals have showed this in the past. So a couple of limitations from this study. First of all, it's an ecological study, meaning it looks at group level data. And what that can be okay, it means you can't generalize things about individual data, which is really important when analyzing diabetes. Also, variation in Boston's neighborhood sizes. So for example, earlier when I showed you the grocery store map and showed you that Dorchester has more grocery stores than other neighborhoods, Dorchester is also a lot bigger than other neighborhoods in Boston as well. For example, I live in Fenway, Kenmore, but I go to central Boston to the Trader Joe's on Boylston Street to do my grocery shopping. So that could be also another limitation as well in terms of where residents are getting their groceries. Also, the sample definition of diabetes didn't, in the survey, which is a Boston Behavioral Risk Factor Survey, didn't separate type 1 and type 2 diabetes, making it harder to make stronger claims about what diabetes affected overall. So some future directions I have personally are, I want to use census tract data first of all, as right now I'm looking at these neighborhoods as a whole, which is fine, but also areas like central Boston, for example, can differ a lot in terms of socioeconomic status maybe. So I want to look more at census tracts, which are more specified locations and neighborhoods to see overall how these residents relate to diabetes rates. Also want to look at individual data as well. It's like it allows us to measure more overall, including the intensity of diabetes these patients have and how far along their diabetes has progressed. And finally, I want to analyze more factors, such as walkability of neighborhoods and knowledge of more resources. So, thank you so much. I'm happy to answer any questions from y'all.
Great presentation. It is on. Great presentation, Amos. I was wondering, what did you think about if there were factors that were sort of related to each other? Like, did you consider doing something like a principal component analysis, or do you feel like they're pretty isolated?
Yeah, I didn't do a principal component analysis. I did make sure I was checking for statistical significance, though, to make sure they were significant related to other values as well. So, for example, when I showed earlier with the p-value for diversity index, I also looked alongside things like median household income present in the data as well.
Another amazing presentation. I had a question. So I know you mentioned for the grocery stores that could have been from the size of the neighborhood. Did you control any of the other factors you analyzed for like the per capita rates?
I did not personally. I just went to the data presented for each one. So, for example, the amount of total African Americans in the neighborhood or Hispanic individuals in the neighborhood, and went with that title in general. I think another future direction on both you guys' questions is in terms of getting this published for a paper in the future, I want to definitely do more statistical analysis with the measures I have. However, I think I kind of just ran into limitations of how much I know statistically, but with the work of people who are a little bit more advanced than me, I definitely could narrow these down a little bit more. So, yeah, thank you.
Hey, awesome presentation.
Thanks, Matt.
So for your so you were talking about some of the future directions that you wanted to go towards, kind of like walkability and knowledge of resources. I was curious, is there any specific future direction that you think would lend itself the most statistically satisfactory for your paper and what you're trying to look for, or do you think really going to the individual level is what you really want to go more towards now?
Yeah, great question. I think individual data is probably the biggest thing I want to do. That does definitely take more effort in terms of what is required for NIB boards, for example, where work with individuals, as for example. I think before I go to that step, I want to find accurate census tract data, because that really allows me to narrow in more to a certain spot, maybe in Mappin or Dorchester. And then from there, I want to talk to individuals more so and figure out their progress with diabetes, their stories, even hearing do they know about these resources? Do they know about the Mount grocery stores? Or what grocery stores do they go to, for example? So I think the individual data is the biggest future direction I want to tackle in the future, but in order to get there first, I need to take some more steps being the census tract data.
Do we have time for one more? Okay. I get to sneak mine in. Great job, Amos. I have a question about one of the characteristics of Boston. So you were pointing out and really highlighting one of the things that we know about Boston in terms of racial segregation, right? Mm-hmm. But the other thing that is, up there in terms of, you make a list about Boston, is the epicenter of the best quality healthcare, right?
Yes.
So I'm trying to kind of understand how you think through that in terms of the availability, right, and this kind of aspect of Boston with precisely your data around type 2 diabetes in terms of the differential kind of burden of disease in these different areas, and thinking through that with one of the earlier presentations in this room, which is the 15-minute city, right? Mm-hmm. So do you think one of the ways in which to go about addressing this is to further localize healthcare, and to what extent is that possible within the highly specialized system that Boston is known for?
Yeah, I think a couple of things I want to use to answer that question. You're right, Boston has some really amazing healthcare for sure. I think a big thing about that is how people know about said healthcare, and also how people arrive to said healthcare as well. One big factor, for example, is mainly individuals, again, who are in the neighborhoods who have high rates of diabetes, often do go to Boston Medical Center, not only based on proximity, but also based on insurance status as well. So really making sure that their process overall, most of them may not go straight to Boston Medical Center, they might go to community health centers, first of all, and really making sure they know the process to best help their needs, whether it is going to the community health center first, and then going to Boston Medical Center first, or even knowing the closest dialysis clinics as well, and making sure these dialysis clinics are close enough. I don't want to go over time, but I remember Andy over here one time last year during junior year, we had to help wheel a person over from the Buick Street stop over to the dialysis clinic by Auto Pizza. And he was coming from pretty far away. I don't know if this man knew whether the dialysis clinic was closer. That was the only option he had available insurance-wise. But overall, we can tell he made a pretty long journey. So really making sure, starting at the resident level, they know the best pathway to use Boston's great healthcare resources overall, and making sure those resources are present to be utilized.
Thank you.
Yeah.